Hello, we are pleased to present to all of you today. My name is Melody Neufeld, and I work as a Client Services Team Manager for Central and Northern Saskatchewan. I am joined by my colleague, Kaylee Elford, Client Services Team Manager for the south of the province. Kaylee and I are here today representing our organization and our Programs and Services Department, which is made up of a team of individuals who work directly with persons with dementia and their families and friends. The Alzheimer's Society of Saskatchewan envisions a world without Alzheimer's disease and related disorders. Our mission is to empower all people to live well with dementia while funding research into prevention, cures, and quality of life. The Alzheimer's of Saskatchewan Board is a board-governed charity incorporated in 1982. We support people with dementia and their families. A person does not need a formal diagnosis to be connected to us. While we are called the Alzheimer's Society, we do provide information and support to those living with many other types of dementia. Canada and Saskatchewan needs to do more to fight stigma. Stigma doesn't just happen on a personal level. Negative attitudes and discriminatory behaviors can be reinforced on a systemic level as well. That's why it's important that Canadians support the first ever National Dementia Strategy, which will take concrete action to eliminate stigma and support dementia-friendly communities throughout the country. An effective, fully funded strategy will also improve standards of care for people living with dementia. This is especially vital for people living with dementia, receiving support and treatment in hospitals and long-term care homes. In September of 2022, the Alzheimer's Society of Canada published the first in a series of 3 reports known as the Landmark Study. These reports represent the first significant update on Canada's dementia landscape and future progressions of the disease since the Rising Tide report was released in 2010. The report includes national breakdowns based on gender and type of dementia, as well as forecasts for each province. The study also looks at the many impacts of Canada's aging population on care partners and steps that governments at all levels and individuals can take to help reduce the risk of becoming a person living with dementia and to create a better outcome for those already living with the disease. Let's take a look at some of the data collected for Saskatchewan. This graph shows the number of people in the province living with dementia by age group. The blue shows in 2020 and the orange 2050. 10 or more people per day will develop dementia, 1 person every 2.5 hours. Between your morning coffee and lunch, someone else in our province will develop dementia. We are expecting to see the numbers of people living with dementia in Saskatchewan to more than double in the next 30 years. This graph creates a visual of the projection of age distribution of care partners of people living with dementia in the province over the next 30 years. This information reflects the number of caregiving hours over the next 30 years. The overwhelming majority of unpaid caregiving work to support people living with dementia is done by children and spouses. The Landmark Study also names the importance of paying attention to the modifiable risk factors. While there are no ways to deal with non-modifiable risk factors, improving modifiable risk factors by getting physical and social activity and by participating in treatment for medical issues can play a large role in reducing the risk of developing dementia. The Alzheimer's Society has developed risk reduction public presentations to speak to the importance of the reduction of these modifiable risk factors. Our role as a society is to create and foster a supportive, knowledgeable community of care to empower persons with dementia to live well and empower care partners to know that they are not alone on their journey with dementia. Having access to appropriate supports early in the diagnosis can make a significant difference in the quality of life for people living with dementia, as well as their caregivers and care partners. Our community of support is rich in information, experience, and services. Our work is about creating a place for people to connect and share their experience and knowledge. We are a place to go to, not as a last resort, but as a first step. In the 22-23 fiscal year, the Alzheimer's Society served close to 2,700 clients from over 300 different Saskatchewan communities. By providing virtual and in-person programming, our resource centers have the ability to provide additional programs to more communities in the province. Additionally, our toll-free provincial dementia helpline phone number listed above is available from Monday to Friday, 8:30 to 4:30. First Link is a program of the Alzheimer's Society that connects people with dementia and their families to that community of support. Our First Link coordinators provide ongoing information, support services, and education as early as possible and throughout the progression of the disease, and empower individuals to identify options that meet their unique needs. By completing a referral to the Alzheimer's Society First Link program, you can assist people to get the support they need as soon as possible. A quote from the Client Satisfaction Survey. I tell people that this is an invaluable support with kind, dedicated staff who meet you and support you right where you are on your journey. At a time of breaking with frustration on what to do next, I found help from the Alzheimer's Society person to get a grip to be able to carry on. It can be a very lonely and disconcerting world without support.
Direct referral to Alzheimer's Society of Saskatchewan from physicians, healthcare professionals, and community organizations is ideal. Traditionally, physicians and other healthcare professionals encourage patients and families to self-refer to the Alzheimer's Society. Sometimes people will self-refer to us, but many times they do not. Or they will call when they are experiencing a crisis. With the First Link direct referral, with the patient's consent, the healthcare professional refers the patient and/or the family to the society. Ideally, direct referrals will become part of the diagnostic process. On the screen is an example of our First Link direct referral form, which can be found on our website. The referral source obtains consent from the person or persons being directly referred to the Alzheimer's Society of Saskatchewan. Our referral is simple to complete, fillable, and now you can just press submit to create an email, which will be sent straight to us. Some physicians' offices have connected it to their electronic medical records. You can refer the person with dementia, the caregiver, or family member, or both. Checking off the contact timeline helps us to determine the urgency of us contacting the client, keeping in mind we are not a crisis agency. Completing the address, the diagnosis, year of birth, and the date of diagnosis, as well as reason for referral and known risks, all assist us to know a bit about the situation prior to us calling the person. Why refer to First Link? Research shows, on average, that those who directly referred to the Alzheimer's Society are found to have received support and services 9 to 11 months earlier than those who self-initiated contact with the Alzheimer's Society. Information and support helps patients and families cope with more confidence. There are community and healthcare services that families may not know how to navigate. With knowledge and skills, people are able to maintain quality of life while living with dementia and plan for the future. The First Link program is the link between your referral and the community support and knowledge we can provide. Quote, "The information I received helped me make better informed decisions on how to help my aunt." Throughout each contact with clients, the risk indicator tool, shown here, is used to determine possible risk of harm and safety for the person with dementia or the care partner in hopes of minimizing acute crisis care. This is the visual aid for our work and within our scope of practice to monitor risk assessment, identify escalating risk levels, and provide additional connection and support where required. The risk assessment information determines when a consult with the team manager is warranted for higher risk situations. It is an important process for addressing high priority situations that are more complex at the right time and in the most appropriate manner. This is done again with the understanding that the Alzheimer Society of Saskatchewan is not a crisis agency.
First Link staff are members of primary healthcare memory clinic teams across the province. These specialty and community-based diagnostic clinics offer a holistic and interdisciplinary approach to a dementia diagnosis, with the goal of providing a diagnosis in a day. Dr. Little, a member of the Southwest MINT Memory Clinic team, describes our role in this way. The Alzheimer's Society First Link program is an important component of our MINT Memory Clinic team, both as a fellow healthcare professional and patient or family resource. As clinicians, we often focus on the medical and functional aspects of our patients and therefore fixate on medications and therapies. Our First Link program representative promotes discussion about the patient and their caregivers as a family unit, ensuring that they remain supported after their clinic visit. The program provides an opportunity for patients and caregivers to connect with others who are aware and empathetic of their situation. They advocate for our patients and their family members through a safe space to explore their diagnosis and prognosis without excessive medical jargon. Our patients and their caregivers are less isolated in rural Saskatchewan because of the services of the First Link program. The Alzheimer's Society has supported some of the research and work that went into developing many of these diagnostic clinics and their frameworks. We have developed partnerships and working relationships with these clinics to help individuals get a diagnosis. Our programs and services staff are integrated into each clinic to provide support and follow-up to people seen there.
Knowledge changes everything. The Alzheimer's Society staff provide leadership for various learning opportunities, such as our evenings of education, which are standalone educational seminars about a variety of topics led by a variety of community and content experts. Using a curriculum-based model, our learning series help people with dementia, their families, and friends to live as well as possible with the disease. The courses build upon each other, providing participants with comprehensive overview of dementia, coping strategies, and available resources. I have always found that I can cope better with any challenges in my life by educating myself about it. I contacted the Alzheimer's Society of Saskatchewan after hearing from an acquaintance that she found them very informative and supportive. I immediately felt comfortable, and as if I had found someone who understood and genuinely wanted to help. Together we can. When you refer someone to the Alzheimer's Society of Saskatchewan, you provide an opportunity for the person with dementia and/or their care partner to feel supported and empowered. You will know that the person you refer will receive information that is evidence-informed research.
Support changes everything. We provide personalized support for each client and evidence-informed information. And we provide ongoing follow-up. Our commitment to our clients is unique in the fact that we attempt to touch base with our clients at a minimum of every 6 months. A quote: "I was getting information and support for a new diagnosis of mild dementia for my mom. I had great help and information over the phone. It helped me understand what we were doing now was good and what to watch for with my mom. We talked about what we could do to help her when we saw future changes." Coffee and Chat is one of our social programs. This is a time when people with dementia and their care partners connect virtually. This is not a support group, but an opportunity for people to check in with each other, get comfortable, grab a cup of coffee or tea, and join some of the Alzheimer Society of Saskatchewan staff and peers online to say hello and let us know how you're doing, or to commiserate about the riders. Another social program we provide is Minds in Motion. Minds in Motion is a fitness and social program that runs approximately every 10 weeks, online and in person, for those person with early stage dementia and a friend, family member, or caregiver. Our support groups are extremely important. We know that caregivers are also on the journey with dementia. Our caregiver support groups run once per month. We have a specific group for specific caregiver situations, and we have groups for early stage dementia. Our First Link staff will work with families and/or the person with dementia to determine which support group may meet their needs the best. Our support groups, both virtual, in person, and on the phone, are a place for people to share and learn together. We also provide. This includes providing unbiased information on available services provided by the Saskatchewan Health Authority, other government agencies, and lists of private or community-based organizations that help support people's dementia journey.
Community changes everything. A community of support. The Alzheimer Society focuses on creating and building a community of support rich in information, experiences, and services. We create connections to provide services that people can turn to and tap into when needed. As you have heard, we offer a variety of opportunities to help our clients learn about dementia, coping strategies, and community supports and services, and we help to connect people impacted by the disease with others who are living in similar circumstances. Our work is about creating a place for people to connect and share their experiences and knowledge. Quote, "The Alzheimer Society informed me of the support and educational programs they provide, as well as the supportive services that are available in the community." Providing a quality service and making a difference in the lives of the people we serve is important. The Client Satisfaction Survey is an identified tool to measure success as outlined in the First Link operational plan presented to the Government of Saskatchewan Ministry of Health. Clients were asked to rate how they felt regarding their contact with the Alzheimer Society. Using a 5-point Likert scale, respondents were provided with 5 statements and asked to provide a rating on each. The staff member was approachable, respectful, and courteous in the conversations with me. The staff member was knowledgeable about the disease and/or questions I had. The information I received was clear and practical. I received an appropriate amount of information. I found the Alzheimer's Society helpful. The average strongly agree rating for this section being 94%. Key highlights from the survey included 85% of clients were satisfied or very satisfied with information, education, and support services. 90% of clients and caregivers would recommend the Society programs and services. 76% of clients and caregivers, including those with complex needs, report they have better strategies for coping with dementia and managing symptoms related to dementia. 65% of respondents reported being more confident in taking care of self, and 81% reported increased confidence in an ability to support the person with dementia. In summary, we would like to extend the invitation to continue our partnership as professionals in the community to better support people with dementia and their families and care partners to live well with dementia. Referrals to us only take a few minutes to complete, and the earlier in the dementia process, the better. Together, we can increase the support throughout the province for people on the dementia journey so that we can all live better with dementia. On behalf of the Alzheimer Society, we would like to thank you for taking the time to learn about our First Link program. We look forward to working together with you to empower all people to live well with dementia.